Called as Enterococus. Let's discuss about a bug. Okay. So if I were to tell you Enterococus, what will come to your mind? Tell me. If I say Enterococus, what comes to your mind? What will come to your mind? If I say Enterococcus,
urine.
what are the things in intensive care or for that matter an doctor will come to your mind? Enterococcus.
Urine.
So Sachin says urinary tract infection. So Alia says GI tract infection. Huh? Correct. You're right. Urinary tract infection. Commonest cause of Enterococcus is urinary tract infection. Commonest place you get it is urinary tract infection. Then it is a gram-positive organism.
Gram-positive, yes.
It is a gram-positive organism. So you must remember this, okay? You will fail your exam if you don't know this. Huh? Enterococcus is gram-positive. Though it is from the intestine. Enterococcus from Greek means from the intestine. Enterococ, C-O-Q-E. Okay, C-O-Q-E. Give the phone, just give me a copy. Though enterococ means C-O-Q-U-E, it actually means what? Bacteria originating from the intestine. We normally think this may be gram-negative, but no, this is gram-positive. In fact, do you know Enterococcus came from where? How this Enterococcus is recent? Initially, you had Streptococcus A, B, C. No, you had Streptococcus viridans, Streptococcus pyogenes, you had all these things, right? A. caricaea, Streptococcus, and then Streptococcus group B from the original Lansfield classification was actually Enterococcus. They used to call it Streptococcus at that time. They were from the genus or from that group D, Streptococcus. Till they realized that it is very different from the usual Streptococcus. Till they realized that it is very different from the usual Streptococcus, and that's why they were called as Enterococcus. So, by definition, Enterococcus is gram-positive. Remember this, Enterococcus is gram-positive organism. It is not gram-negative. And once we think of Enterococcus, we have two organisms that have Enterococcus. One is Enterococcus fecalis, and the other is Enterococcus faecium. You need to know both of them very well. Enterococcus fecalis and Enterococcus faecium. Anything about them? Anything that you know about Enterococcus fecalis and Enterococcus faecium? Anything that you know about it? So when I think about infections, there are three major infections that come in when I think of Enterococcus. One is urinary tract infection. Okay, one is urinary tract infection. The other is a GI infection, and third, most important, is actually your infective endocarditis. Okay, when you say infective endocarditis, one of the things that comes to my mind is Enterococcus. Right? Clear on this? Enterococcus. Now, what are the two organisms I'm looking at? Fecalis and faecium. Both are different. I'll tell you how they are different. Enterococcus fecalis is more virulent, but it can cause damage quickly. Enterococcus faecium is less virulent. It is virulent, but less virulent as compared to the fecalis group. Understood the difference? Enterococcus fecalis, and repeat, is more virulent as compared to Enterococcus faecium. Clear? Now what is the next thing about Enterococcus fecalis and faecium? See, the Enterococcus fecalis is usually very, very sensitive to ampicillin, to penicillin derivatives. Okay, they are very, very sensitive to penicillin derivatives. Clear? It may work phenomenal with ampicillin. It may work with penicillin very well. You understand? Just give penicillin, it will be okay. Just give ampicillin, it will be okay. Enterococcus fecalis. But however, Enterococcus faecium. So the problem will come when you look at Enterococcus faecium, fecalis. The problem will come when they harbor an enzyme called as penicillinase. When they harbor an enzyme called as penicillinase. That's why what is required when you are treating a severe Enterococcus, if it has got a penicillinase, What will I want to give along with ampicillin? Something that inhibits the penicillinase. What is that called as? Beta-lactam inhibitor. Penicillinase is a beta-lactamase, right? You are understanding? Not understanding? Ashok. So if you don't understand, no problem. So Enterococcus, see, Enterococcus is usually penicillin sensitive. मतलब उसका penicillin sensitive penicillin sensitive रहता है. Clear? That is why ampicillin works. Ampicillin is a penicillin. That's why ampicillin works. Ampicillin works beautifully. Right? Clear? Huh? So if this comes resistant, if you have Enterococus fecalis and it shows penicillin resistant, what does it mean?
That bacteria doesn't produce penicillinase.
Bacteria produces penicillinase, no?
Resistance.
That is why it is resistant to penicillin. So penicillin देगा, तो penicillinase finish कर देता है उसको. So it doesn't work. Are you understanding? So if you see an antibiotic gland, you see Enterococcus fecalis, you see penicillin, and you see resistant. What do you think? There is a beta-lactamase enzyme here. The beta-lactamase enzyme, penicillinase, is preventing the penicillin from working. Ideally, it should work. समझ में आ रहा है? Clear on this? So how do you get around this?
Inhibitor, penicillin.
Inhibitor. So you give beta-lactam inhibitor, beta-lactamase inhibitor, beta-lactamase penicillinase inhibitor. So penicillin inhibitor is sulfactam. That is why you give ampicillin sulfactam. Clear? Am I clear? Clear on this? You understood
Yes.
now? Huh? So that's why we give ampicillin sulfactam for Enterococcus. Clear? Penicillinase. Inherently they are resistant to cephalosporins. Remember this. Inherently it will not work with cephalosporins. It works very beautifully with penicillins, but it will not work with cephalosporins. Cephalosporins is not going to work. Right? Now we go to the other side of the story. Enterococcus faecium. Now what did we say? How this gets resistant? How did fecalis get resistant? By production of penicillinase. By production of penicillinase. Unfortunately, the Enterococcus faecium gets resistant by altering the penicillin binding proteins only. By altering what? तो penicillin ही चिपकता नहीं है उसको. So will it work with penicillin? No. Will the addition of sulfactam work here? No, because the mechanism of resistance is different. Are you understanding? Huh? Are you understanding? Because the mechanism of resistance is different. Sachin, कुछ समझ में आया कि नहीं? कुछ नहीं समझ में आया. So now that you can make him understand, you take his video, take her video. हाँ.
As Enterococcus fecalis produce penicillinase, so when beta-lactam is given, so it is resistant.
Penicillin.
Penicillin.
Don't say beta-lactam because cephalosporin resistant होता है penicillin.
Penicillin is given. It produces resistance to that. So for that purpose, beta-lactam, we have to give beta-lactam inhibitor.
Beta-lactamase inhibitor.
Beta-lactamase inhibitor for Enterococcus fecalis. And in case of and on the other side, like Enterococcus faecium, there is a change in penicillin binding protein.
So penicillin doesn't get attached to it.
So it will not work here.
It will not work only. You got the point. So even if you give ampicillin sulfactam at that stage, now I will explain this again to you. Enterococcus fecalis, more virulent compared to Enterococcus faecium. Enterococcus fecalis, urinary tract infection, abdomen, and endocarditis. Okay, Enterococcus fecalis, as what Enterococcus produces, if you find Enterococcus fecalis, classically they are sensitive to penicillins. That means they are sensitive to piperacillin. That's why they are sensitive to ampicillin. Are you understanding? They are sensitive to penicillins. Clear? Now, if you find this resistant to penicillin, resistant to ampicillin, okay, this means it is producing something called as penicillinase. Penicillinase is the enzyme that it is producing, which is destroying the penicillin. This is called as beta-lactamase. This is called as beta-lactamase. So, if I give an inhibitor to this penicillinase, it will start working. So if I give ampicillin sulbactam, the Enterococcus can be taken over. That is why you have a combination of ampicillin and sulbactam. Clear? Clear on this? Whereas in Enterococcus faecium, what is happening? The problem is Enterococcus is getting resistant because of the presence of penicillin binding proteins. Right? And when you have penicillin binding proteins in place, whatever you do, the penicillin is only not getting stuck. So it doesn't work only. Clear? Clear on this? So now you've understood what is the basic drug I want to use. The basic drug I want to use is ampicillin for Enterococcus faecalis, whereas for Enterococcus faecium, I will have to use something else. Something like vancomycin, something like daptomycin, something like linezolid. Though both are gram positive, okay, for Enterococcus faecium, I can't use these regular medicines. Clear? Clear on this? Though both are gram positive, I can't use ampicillin. Clear? Now the question comes, I am in a situation where I am going to be dealing with difficult. If it's a UTI, that's okay. UTI में कुछ भी problem नहीं है. UTI में there is a passage of this particular bacteria out of the body. Cystitis हो गया, pyelonephritis हो गया, कुछ भी रहने दो. बाहर जाकर निकल रहा है. It is going out. So it is not very severe. Are you understanding? Though it is very common to have enterococcal infection in the urinary tract, it is never severe. Are you understanding? Because it is passing out. No, it is passing out. Clear? But what happens when there is endocarditis? That is where the problem starts arising. When you have endocarditis, that is where the problem starts arising. Because now I have to ensure that I actually kill and remove the bacteria. It is physically not doing it. It is physically not doing it. It is not physically taking it out. You have to take it out. And to take it out, you have to kill it. You have to finish it off. Right? That is why I need to have 2 antibiotics. एक antibiotic से मेरा काम चलता नहीं. So the question is, which is the antibiotic that I can use apart from this? I can use an aminoglycoside. Now, what is the problem with an aminoglycoside when I'm looking at Enterococcus? If you look at endocarditis guidelines, it will be a combination of ceftriaxone and gentamicin, or ampicillin and gentamicin. That will be the combination we will be probably giving in these cases. Ampicillin, gentamicin. Now, why is that so? Ampicillin works on the cell wall. Ampicillin works on the cell wall. Okay, remember this. Gentamicin, aminoglycosides are impermeable to Enterococcus. Gentamicins, aminoglycosides don't enter. They can't enter. Impermeable. Cell wall की वजह से अंदर घुस ही नहीं पाता है वो. It doesn't enter only. So if you give a combination, what happens? Ampicillin breaks down the cell wall and gentamicin gains entry into that. You are understanding? That is how it kind of works. समझ में आ रहा है? Are you understanding? That's why a combination of ampigenta is what you normally give when you have Enterococcus. It will work together. Clear? So this is one of the few places where you want to give gentamicin 3 times in a day. Endocarditis. Because we think it's going to work this way where the cell wall inhibitor will work, at the same time gentamicin will gain entry inside. Unlike otherwise gentamicin we give once in the day, aminoglycoside we give once in the day. Here you may want to give it 3 times in the day. Clear? Very rarely, you may get something called as vancomycin resistant Enterococcus. Now vancomycin is a very funny drug. Vancomycin, if you want to give, it's a very difficult drug to give. If you want to give vancomycin, it has to be dosed very well. It has to be dosed in very good amounts. So if you want to give it for infective endocarditis, I have to dose it very high doses. When I give very high doses, what gets affected? The kidney. Vancomycin is excreted to the kidney. So it gets affected. So it's not a great drug. But it gives us an idea as to whether it is resistant or not. So if you have vancomycin resistant Enterococcus, this is called as VRE. It is a multi-drug resistant organism. You may want to use something different like linezolid, like daptomycin. Now you must understand, linezolid is bacteriostatic. It is not bactericidal. Vancomycin is bactericidal. So in cases like infective endocarditis, what do I need? Bactericidal action. So now you can understand how difficult it will get to actually use just linezolid. You may want to use daptomycin, but daptomycin works beautifully in these cases. That's why you want to end up giving daptomycin, which is bactericidal in these patients. Clear? Now take it the other way around. You have a patient with enterococcus in the lung, and that is VRE. It becomes very difficult to cure. And if the patient is very sick, because daptomycin doesn't penetrate into the lung, it doesn't go at all into the lung. It is inactivated by surfactant, so it will not even go into the lung. You are left with very few options, of which one is linezolid. You understand? And this is bacteriostatic, so you have a problem treating it because धीरे वो treat होने वाला है. Bactericidal is equal to bacteriostatic unless the patient is neutropenic, unless the patient is having infective enterococci. Clear? It's not this way that bacteriostatic drugs are inferior. It's not this way. But it's only in two cases where they are said to be inferior. One is neutropenic sepsis and infective enterococci. Clear? Enterococcus. So enterococcus gains resistance by various methods. One is called as plasmid mediated. So if you have a patient who is on enterococcus, I won't treat it well now. I just want to, I'll say enterococcus was coccus. I just say ampicillin work, let's just give ampicillin. You will not think like that. Enterococcus is known to get plasmid mediated resistance. Now what is this? ये क्या होता है? Plasmid mediated resistance क्या होता है? अभी मेरे पास in my urinary tract, in my nephron, I got enterococcus. Now along with the enterococcus there is something else also. Like for example, there is some small amount of E. coli. And that E. coli has got some resistance pattern. Okay. Now this resistance pattern is on plasmids, plasmid mediated. It's called plasmid. This plasmid jumps from organism to organism. So during treatment, enterococcus can become resistant because it has got plasmid mediated resistance. Clear? That is the reason that when you are treating enterococcus, you have to be very careful that the patient is clinically improving. That is very, very important. You understand? Clinically important because it has got plasmid mediated resistance. Normally you have something called chromosome mediated. वो change नहीं होता है. Body में जो है वो है. Bacteria के अंदर जो है वो है. उसको acquire नहीं करने होता है. ये acquire करता है. Enterococcus can acquire a resistance. Are you understanding? Clear? Clear? Anything about enterococcus you want to know further? Is all very clear now? Infective endocarditis, abdominal infection, urinary tract infection, cystitis, pyelonephritis, and why we are giving what, difference between fecalis and faecium, why you want to notice vancomycin resistant enterococcus, how can it be difficult in the lungs? I think gone to everything, isn't it?